Brady, your light is on in your room. Brady. Whoever stuff is all of this. Brady, this is your mask and your hands. Brady, turn off your lights. I'm coming. You're taking too long. Kiela, turn off your light. Our light is on too. Yeah, all stuff.
Evening, Gina.
Hi, Kevin.
Good evening.
Hi, Tony. Long
Hello.
time no see.
Yeah. Regina, if it's okay with you, I would like to move 8A, which is the COVID routine safety checks, formerly called formerly called pool, into 4A, so we only
Yeah.
talk about COVID at
Once.
one time.
Sure.
Is that okay?
Yeah.
Hi, Michelle.
Hi, how are you guys?
Good.
Getting used to the dark at 3:55.
Uh, Tell me when you get used to it.
Well,
It is nice. I get up early, so it is nice at least to see the sun sometime in the day.
yeah.
Oh, cold though. Not tomorrow.
Oh, I know. We've actually had a mild beginning of winter. Not quite winter.
You can play golf all year round on Nahant.
Yeah.
Kevin, you're going to
Yeah.
talk about the visiting librarian schedule, right? I mean, globally.
Yes, I will. Yeah, the initiative.
Okay.
Mhm.
And also the Professional Development Friday, January 14th.
Yes, please.
Okay.
Tony, do you have an update for the school committee on OT staff? Occupational therapy.
Well, I have a sort of an update.
I don't know if we announced anything about Molly leaving.
Yes. I'm almost positive I did. I have it in
Okay.
my notes.
Okay.
And all I was going to say is we're in the middle of interviewing
Yep.
and for the OT, PT, and also for the team chair.
Yep.
And we do have 3 people interested.
Hi. Hi, Lauren.
Hi, everybody.
Hi.
Hi,
There's
Patty.
2 of you, Patty. Do you know that there's 2 of you?
There's 2 of me. All right, let me log out of this.
There's another one of you trying to join. No, it might just be that this other one doesn't join. All right, just you might get an echo if it. Okay, well, there's enough of us here. I think we can get started. I'll disable the waiting room. If everybody's okay with that.
Yeah.
Yeah.
I don't know what happened to Camilla. Well, we can call the meeting to order at 7:03. If we could all rise to say the Pledge of Allegiance. I pledge allegiance
to the flag of the United
the
States,
United States of America,
and to
and
the
to the
republic
republic
for which
for which it stands,
one
one
nation,
nation, under God, indivisible,
with
with
liberty and justice for all.
So our last meeting was on November 16th, and the minutes will be in your packet. If anybody has any discussion regarding the minutes, and if there's no discussion, if somebody could make a motion to approve the minutes.
I'll make a motion to approve the minute on 11/16/21.
Michelle?
And I'll second that motion.
All in favor of approving the minutes from November 16th as written? Ms. Sherlock, Ms. Dam,
Jenny from
I'm
before.
here. Is this my hand with this wacky background? Sorry.
Oh, I couldn't see your hand. All right,
Yeah.
motion carries. All right, Mr. Parentazzi, do you want to walk us through the bills for this evening, please?
Yeah, Madam Chair, thank you very much. I would like to do the examination and authorization of payment of bills. First thing I'll do is give the members of the school committee the total, which is $78,933.82. I'm going to get into some details about the facilities expenditures later, but suffice it to say, I think these are all very, very typical this time of the year. We're adding educational materials. We're doing facility upgrades. We have an electrician's bill. We put a new pump in the heating system. Monthly bills for our technology, for our copier, extermination, etc. Both bus companies have bills in here. We have bills for our food service department, and we have a bill for our behavioral specialist. The only explanation I would like to make sure the school committee members get is that there's a $53.13 for Ms. Katzos. That's a charge she put on her credit card for QuickBooks, and we are reimbursing her. So, Madam Chair, with your permission, I would respectfully ask that the school committee entertain a motion to approve the December 14th bill roll for $78,933.82.
Just a really quick question, Mr. Parentazzi, the Marblehead Public Schools bills, those are for charter?
Say that again?
There are
Ms. Charlotte?
two bills for the Marblehead Public Schools. Are those for charter?
No.
Oh, okay.
When we have a special education student, and we don't have many,
Oh, yes, okay.
who require a substantially separate program, we
Yeah.
try to keep them as close to us as possible physically. So the first place we look is Swampscott. There's a couple of bills for that in here. The next place we look is either the Northeast Consortium or Marblehead.
Sure.
And because they're larger, they're all larger than us, they have more substantially separate programs.
Sure, sounds good. Thank you.
I'll make a motion to approve the bill roll dated December 14th, 2021 in the amount of, oh, my glasses, $78,933.82.
I'll second the motion.
Thank you, Ms. Sherlock. All in favor of approving the bill as written? Ms. Karas, Ms. Sherlock, Ms. Dam, and myself. Motion carries. Mr. Parentazzi, I know that you included some COVID-19 updates in our communication, but could you give us an update on COVID-19? And we're going to move 8A up to be included in this discussion.
I would be happy to, Madam Chair. Thank you for the opportunity. The first thing I would like to do is, as I always do, give you a community outlook, a summary. We now have 14 active cases in the town of Nahant. There are 2 children with active cases who are not Johnson Elementary School students. They go to schools off the island. We have 1 student who is positive. That student, the COVID-19 transmitted to them from a non-school contact. Interestingly, that student has been out of schools since last Wednesday. Initially, they tested negative, but yesterday it was a positive, so they would be quarantined according to the public health nurse to the 21st of December. Because of our protocols and your guidelines, which we're following, there have been no close contacts in the school. There are 3 staff members that may have been close contacts, so with an abundance of caution, We have put those individuals in the Binex Now testing program that we have, the test and stay. And they are obviously asymptomatic, because if they were symptomatic, they would not be here. And B, they have consistently demonstrated negative responses. So other community news, which is really good. We have approximately 166 5 to 11-year-olds who reside in Nahant. 92 of them have reported, it has been reported to us through the technology systems used. 92 of them have had their first shot, their first vaccination, which is a very high rate for this time. 19 have had both. Obviously, lots are waiting for the second one. Our clinic on the our next clinic will be on the 21st of December from 5 to 8 p.m. at Town Hall. And that clinic will primarily be for the second dose of the students who had the first dose at our first clinic. However, there will be extra vaccination available to other individuals at that time, just like there were last time. Also, in your packet, I put the booster clinic that the town is sponsoring. And that is this Thursday, November 16th, 4 to 6 p.m. It's a very short window, only 2 hours. But in that clinic, all 3 vaccination will be available: Pfizer, Moderna, and J&J. And that, again, is for boosters. But once again, I think it's important for everyone to know, you can't pre-register if you're not going to get a booster. And in the pediatric clinic that we're hosting on the 21st of December, you cannot pre-register unless you fall into the age category. However, by showing up, there is almost always going to be some additional vaccines for I guess a walk-in. I guess that's the easiest way to say it. Okay.
I think they did it first come, first serve for the extra vaccines.
Yeah, it always is that way with walk-ins.
Yeah.
I mean, with anything.
Yeah.
So, by the way, on the 30th of November, we gave out 121 doses. Interestingly, most of them were to adults. Most of them were walk-ins. So, don't know how many we'll have this time. The other thing I want to bring to your attention is that we are really utilizing the Binex Now antigen test, the test and stay. And it's really working well. I personally had a test last week. I was negative. And so it's really very convenient, and it's a very good system. And it's just like when you go to a clinic, you give them the information, you take a picture of your vaccination card, they take they do the swab, and you have a choice. I did it myself. And 15 minutes later, I got an email that gave me my results. They're pretty cool. The other thing about, I want to respond to a parent who contacted me about our school buses. It's the responsibility of our school bus company to make sure that students and drivers wear masks at all times. It was reported to me that that may not be the case all the time, or probably isn't the case all the time. Maybe even is not the case all the time. So I talked to a very high-ranking person in the Healy Bus Company, and I was assured that on a daily basis, the company reminds drivers to communicate the need for masks to students and to wear their own mask. Obviously, a school bus driver is watching the road during the trip, and it's a tough thing to do, but we will continue to really emphasize that. And I'm not quite sure because, I mean, typically if we had a concern like of this nature, Mr. Andrews will put it in the newsletter. But on Thursday, he and I will talk about how to get the information to the principals of the schools in Swampscott to make sure that the students are getting the directive from a different source. I mean, in cases like this, the more sources, the better.
Mr. Parentazzi, I just want to, contribute to that. So I had sent to the other school committee members the reopening plan from last fall, and in reading it and in hearing what you're saying, I just want to bring up that it included in the reopening is the guidelines for, masking on the school bus, and that we do have it in the protocol. It's probably like a DASE, statewide guideline that, they have to be wearing them on school buses. And if they're not, it's outlined in our reopening that is like the, multiple strikes you're spoken to. And so if it's a frequent offender, like the same person, I feel like we could pull that in to have a discussion, with that student or family and reiterate what our expectations are, for riding the public school bus, right?
Yeah,
It's tough.
the problem we have, Madam Chair, that's a little more difficult to handle than a pre-K through 6th grade student who is not following guidelines is that these students technically go to school in Swampscott.
Right.
And even though we're paying for the bus and they're our residents, they're considered to be Swampscott middle school and high school students.
Yeah.
So I think the way to handle it is for Mr. Andrews, principal to principal,
Yeah.
to send the message. And we can put something in our newsletter because obviously a lot of these parents and guardians of middle school and high school students also have an elementary student. So
Right.
we'll handle it both ways.
Yeah.
The other thing I've suggested to the bus company is to actually put signs on the buses to remind kids. And I was told that that's already happening, but frankly, I haven't seen the sign. So
yeah, let's be honest, they know that they're supposed to wear masks. They're just choosing not to, right? I mean, it's not something that's new or.
Right.
I think it's hard because they're, at this age level, it's probably the appropriate thing that there isn't a monitor on a school bus. It's not the way it is, but without a monitor on the school bus, it's pretty tough. I've heard from multiple sources, and of course, I'm not there to witness firsthand, but that it isn't just one student, it's pretty much everyone on the entire bus having no mask on. And so it's pretty difficult. I think it's the culture, perhaps, is what I'm hearing on the bus, not to wear masks. And I think that the students may have become comfortable with that as windows were open. Not that I'm saying that that's what I would advise, but I think that may have been how things started off, perhaps. And anyway, I know it's a tough situation. It's probably a tough one to fix for a bus driver who needs to safely drive, to also be able to, control the behavior of a whole busload of people behind them. And I don't expect that that's an easy problem to solve. I wonder if it's possible, and I don't know if it is, to even send out a mailing or an email to the parents of middle school and high schoolers. I don't know if we have a list that we could use. No. Okay.
No, that's why I
to reach
think,
that audience.
yeah, I think the best way to do it is principal to principal.
Yeah.
And, because what can happen is then a member of the administration at the middle school and the high school, as the students load the bus, can be there and can physically remind them.
That's great. Yeah, that would be
I-
ideal.
And I would imagine that Swampscott and every other school district in the entire country and world is having the same issue.
Right,
I'm sure.
right.
I thought of telling the bus company to open all the windows in the morning.
Hmm.
But then, the bus driver who's driving the bus and the students, if they're cold, they're going to close the windows, and the bus
Right.
driver can't be stopping the bus all the time.
Right.
So
Absolutely.
it's not an easy one.
Yep.
But once again, the news for us in the elementary school at Johnson is all good. Our students are coming to school, they're safe, and we're very happy.
Were you going to talk about the pool testing also?
Yes,
Where
ma'am.
we stand with that?
I'm ready to do that, and I shall do it. Before I do it, I do want to say that I put an Appendix A in your packet that lists the various types of testing.
Mhm.
And so right now, we will be doing all of them except that last bundle that I crossed out, which is safety check and lab-based
Mhm.
follow-up testing. We're just not doing that. With the other forms of testing that we have in place, we don't need to do it. So the first thing I want to tell you is that pool testing is now called COVID-19 routine safety checks. They're not doing pool testing anymore. I think it sounded too much like a chlorine test in your swimming pool. I gave you a letter, which unless you tell me otherwise, I will authorize to be sent to all of our parents and guardians tomorrow. And this letter is informing them that we are beginning the routine safety checks and that they can sign up for it. It also has a graphic that explains how it works. Very quickly, it's this way. The family completes an online consent form on Tuesdays, starting next Tuesday. Groups of tests are put into a larger vial. So the tests are done, they're put into a tube, and a certain number, somewhere between 3 and 10, are put together. That group is sent to the lab. They're picked up and sent to a lab, and it's a PCR test. Now, that's important for parents to know. So it is anonymous. So the PCR test is done on each of the vials, and then there's either a negative pool result, which means nothing happens, or there's a positive pool result. The positive pool result means that at least one of those vials in that number tested positive with a PCR. If that happens, then we do a BinaxNOW antigen test here at school. Obviously, if they're negative, we continue to do it. If they're positive, the student is isolated and sent home. So what this is theoretically doing is finding some of the asymptomatic students before they communicate COVID-19 and cause positive results and symptomatic transmission. It's one of the tools we use. We're not we're not suspending any of the others, the symptomatic testing or the testing for or the test and stay. So this is just one more tool in our tool basket. We do have 2 people that are being paid for by the federal grant from CIC, which is the company that has the contract with the Department of Elementary and Secondary Education. Our public health nurse and particularly our school nurse has trained them. So we are really ready to go. I think once the parents find out that it's a PCR test, they're going to be very pleased to have it happen. So right now we have 163 students in school. 73 of them have already been authorized for the routine safety checks. So that's really high. I mean, that's almost 50% before we even advertise it strongly. So I think we're gonna have a very strong positive reaction to this.
What strikes me is that it seems like this could be a potentially, beneficial move for our community outside of school, because it seems so far like we've had no in-school transmission, which makes me very happy. It makes me feel like we don't really have a problem to solve. We even when students come and they end up having COVID, there hasn't been in-school transmission. So I feel quite happy and proud about the fact that our protocols for reducing transmission work. So it's not like we have outbreaks and we're trying to figure out where they are and how to stop them. We don't, which is great. And it seems like if there are transmissions in town, they seem to be happening outside of the school. So it seems to me like if we're starting a new program like this, it would be more to curb spread in social situations that is also important, but really not within the school.
Yeah, and Madam Chair, it's completely up to you and the members of the school committee. We have been adding testing with an administrative decision, obviously brought to you before we did it. And if you would like the school committee to actually take official action on this, I would be happy to support that. Or if you would want to leave the decision like you have with the test and stay as an administrative function, that's okay too. But unless you direct me not to do this, I have every intention of beginning the process tomorrow with that letter that you have in front of you, the top half being the letter and the bottom half being the visual depiction of how it works.
I have no problem with it. I see it more like a public health tool than I do a school
Yeah.
related tool.
I have a couple of questions, and just for clarification, because obviously the PCR test is the more sensitive test, and that's going to be the initial test that's done on a bunch of samples, and then we're going to come back and do a less sensitive test for individuals. Like while yes, I think people understand the PCR test is more sensitive, I don't understand then why we would come back and do this other test that's not even approved for use for asymptomatic people. I just think it gives a false sense of things still. I still think that from the time I had brought it up.
Madam Chair, Ms. Dam states a question or a concern that I had this very day when I met with the public health nurse and the school nurse. First of all, this is the program that the DESC has authorized, and we can't vary it. So CDC will only be paid to do this program, number one. Number two, I have been told emphatically that the Binax Now antigen test has improved somewhat. I don't know, greatly, a little bit. I don't know. But from its origins, I have been told that they are more accurate now, particularly with positives, that the incidence of negatives, I apologize. The incidence of tests being run with people who later test positive and test negative with the antigen is down. It's not my field, so I don't know.
I
I would say
believe
that serial testing seems to be what leads people to have increased confidence in the Binax Now. So if they were testing every day I think this is alluding to if you have a positive within a pooled test, that members of that pool would be tested daily for a certain amount of time, Mr. Parentazzi? Almost like a test and stay program?
Yes.
Yeah.
We haven't found any issues with Binax.
If that's done, I
Actually-
think that the confidence goes up. I think that's one of the.
Yeah, actually, what we have found is we're talking minimal numbers, so this is not a trend. It's just something I'm aware of, so I'm going to say it. A student who is now in isolation and was exposed last weekend, the PCR test was negative for a significant number of days, and then it was positive. So it happens with all of them, I guess. I don't know.
You're right.
Yeah. I mean, I asked the exact same question you did, Michelle. You know, if we're going to give a PCR test, why don't we do another PCR test?
Right. That seems to be because
It's just
I mean,
not the way.
we could encourage families to go to one of the testing sites and get a PCR. I guess my other question and follow up to that is, so let's say, 8 tests go in the pot. What then, I mean, I imagine from what you've explained to us that those students will continue to go to school until we figure out who's positive. And that could be, 2 school days, that could be, you could get a rapid positive right away. It also could be one person in the, in the pot that's positive. It could be 3 people in the pot that actually have it. Who knows? But
Well,
I guess I'm just confused about what you then do with those people who we don't know, especially when everybody's antigen comes back negative at first. Does everybody have to isolate and assume that they have COVID and they're just asymptomatic?
okay, so my understanding, and I think I have it right because I've asked a lot of questions. Let's use the number 8 again.
Yeah.
8 students, vials are put into a pod. They go off and they get a PCR, excuse me. And then X number come back positive. We know the nurses will know what the number is.
Okay.
They won't know who.
Oh, okay.
So they will know that they're looking for, let's say, 3.
1 or 2 or 3 or okay.
Not 1, not 8.
Mm-hmm.
And the other thing I've been told is the reason that the second test is the Binax Rapid is so they find out in 15 to 20 minutes,
Right.
so that the student can be isolated rather than waiting 2 days while they're in school.
Right. You don't really want to
And
isolate.
then we will, and then if we get the Binax positive, so let's start again. 8 in the pool, 8 in the pod, 3 come back positive, 3 show up with a Binax positive, then our nurse will send them home and say, get a PCR.
The other,
to
go ahead, Michelle.
So I think similarly to Gina, are the samples going to be pooled by class, so such that you know who you have consent from, that it is identifying in some way, that it affects everybody else while you're waiting, like, you have multiple children going to the school, are they going to be considered, a close contact of somebody waiting testing? Like, these are the things I think families are going to find important and that we need to discuss and make sure that we know the answers to before we say that this is going to be okay to do.
I'm sorry. Let me see if I understood. We have three children in a family, and they all go into pods, and one of them is in a pod where a positive PCR comes back. If that child is not the one whose Binax is positive, then there's no isolation in that family. If that child is the positive, is one of the Binax positives, that child and that child's siblings will be handled by our nurse just like they would with any other positive case.
So you had said earlier that the children will be tested, like the test and stay program for those 7 days. And I was under the impression that during that time period, the children were only allowed to do the test and stay if they isolated or quarantined, whatnot, and were only
No. The test and stay program is for asymptomatic children who are in school.
Right, so I guess that's my confusion then is, are they being considered, these children in this pod of pool tests, are they being considered as needing to quarantine in any way while they are testing for 7 days with that Binax now?
Yeah.
No, they wouldn't be tested every day. They're tested once a week on Tuesday.
But the ones who came back positive in that pool, so the pool went in, someone in that pool came back positive, that little pod gets tested every day now, right? Just like the test and stay kids would,
Until you get a positive.
if one
I
within their
think-
pod was positive.
No, I don't think that they continue. I think you just get
No.
tested until you get a positive. I guess my
No,
biggest
they get
concern is
they-
that the antigen is negative, and I don't think that that's a low. I guess that's my biggest concern, is that if the rapid antigen is negative, which giving it's less sensitive than the PCR, it's a strong possibility that you can test these 8 kids, 0
Yeah.
of them have positive antigens. And so then the idea behind that is they would continue to attend school. They'd continue, I mean, we have understood, and we've discussed this before, we know that some asymptomatic kids are in school likely at some point or another that have COVID. But now we knowingly have the student in school who there is at least one who, is asymptomatic positive and the antigen is negative. Because you're not going to send these 8 kids home just because you don't know who it is. So I guess
No, but they're going to, I understand the question now.
Yeah.
They will continue to Binax now until they find the student. Or
Right.
if they don't find a student in X, and I can't tell you how many, in X number of days, they're going to assume that it was a false positive.
Mm.
And then the next week, they'll have another PCR.
There's one more thing to consider, I think, is in healthcare, whenever we're talking about screening tests with our patients, we make sure that there's informed consent about the fact that you can find things, right? And this is one of those, and that finding things leads to stress. And sometimes what you find is a false positive, and sometimes what you find is something that may not end up meaning anything. And when we have something like this that we're implementing, it's a screening test for asymptomatic people. And so I'm imagining, a pod of students being tested and one is positive, and let's just use that number 8 and say there were 8 kids in that pod of tests, that were all tested. Now 8 families are informed that there's a possibility that your child has COVID, but maybe not. We don't know. And now everyone is losing their hair and not sleeping while I'm just saying, as a parent, I guarantee that you're going to have at least 6 of those parents who are going to be pretty anxious about it while they're trying to figure this out. And so I think that as we think about this program, we just have to take that into account. That's something that we always take into account in healthcare too, when we're ordering things just like this. This is a healthcare, initiative. So we have to kind of think about that. It doesn't mean I have a strong feeling. I haven't decided quite yes or no, but I think it's something to consider. There is harm to stress, and that's just something to think about. And kind of what I said in the beginning is just kind of still on my mind is, as a Johnson school, I'm not sure we have a problem right now. And so this is an initiative that may have some other repercussions that we just need to think about.
Yeah.
And I'm still a little confused about you continue to test, and I don't see that direction in the information of how many days. Is it just one test when you get that pooled positive test for those children that you're testing every day? And I just want to make sure that if the answer is we are testing until we get a positive, or we are testing until X day, then we assume it's a negative, those children, are they considered being tested for COVID? So it affects what they do, it affects what their siblings do. I just want to be very clear about what.
No,
It wouldn't. There's no quarantine associated with it.
yeah. And these are, I mean, I haven't said it, but I'm I'm sure we all understand this. These are all asymptomatic
Right.
children and adults, none of whom, if without this program, we would have any inkling
Right.
would have COVID-19 virus and be asymptomatic. So
Right.
that's the advantage of it.
But to
And I think Mrs. Sherlock is very, very accurate that the training that the staff has done with the CIC staff is about how to handle this in a sensitive, caring, and positive way. What we're not trying to upset anybody or get anybody fearful, but I mean, I have to say this. I mean, if a parent doesn't realize that there are asymptomatic people all around us, I
Right. Right.
can't imagine,
realizes
you know, what they've been hearing for the last 20 months.
Right. And I don't think it's the stress that there are asymptomatic people around you. It's just more, what do I do with my child if I don't know that they have COVID? And I can appreciate what Michelle is saying. Like,
Yeah.
and it's really I think that the concern is around those situations when you have a positive pool test and we don't know who it is. It
Right.
works. It sounds like it works very well when you have a positive pool test and the antigen comes back positive and you have the person and then you move on. And I think to Lauren's point, like we can all recognize that no system is perfect, and we have to recognize the pieces of this program that are not ideal and may provoke some stress. And just full
Yeah.
disclosure at the time of enrollment, because this is entirely at the parents' discretion if they want to enroll their children in this. So as long as they
Right.
understand that there is very well going to be a time that they might be told that their child might have COVID, but they might not, and what that means. So
Yeah, and our letter clearly establishes the opportunity for parents to contact Cheryl and ask questions, have a conversation. And as you all know, she's terrific at it. So, it's not like we're in a school with 1,000 students and one nurse and, there's no access. Parents are constantly communicating with her. And I do know that the communication with the parents will be rapid, just like it is with a rapid test, obviously. So, yeah, I will talk to Cheryl about, what to do when you have the positive PCR in the pod, and then all the negative Binax now, what's next? Because that's a really good question.
Yeah.
I mean, as a parent, I would say that it might be, I don't know what the protocols are for the, healthcare providers that are in the program, but it might be worthwhile to wait those extra 15 minutes. That way, when you have the conversations with parents, ideally you already know, your child was pool tested, the pool came back positive, but your child does not, in fact, have COVID. We identified the person that does that, in those situations, that would be probably preferable. I don't know if they have to immediately tell parents.
They do that. It's done. It's done electronically.
Yeah.
Just like when I had my Binax text, I got an email. We have a system. We're also instituting something else, which is really, in my opinion, very convenient for parents. Any parent who has signed up to this date, and as I told you, 73 children have already signed up for it. They have had to go to a link and fill it out. Once we start this routine safety check program, what we're going to do is preload the information for parents and send an email to them, and all they have to do is say yeah or no. So it's going to be really convenient for the parent.
So these are the people who have already consented to the individual testing?
No, these are parents who have not approved. the testing that we have in place was not just consent for the testing we have in place, but the routine safety check was actually in the approval process.
You had to check them separately, which ones they
That's right.
you enroll in.
So,
Okay,
so we're going to remind the parents, and then the ones who we don't have consent form, we're going to preload the information, so all they have to do is say yes or no. It would have been nice if we had this set up a couple weeks ago, but we didn't.
Okay.
so I think, yeah, I think as long as they are, you know, it's an opt-in, they
Yep.
are aware of the consent, they, you know, that they have consented to this and what that means for them, and, you know, the impact of that, the impact of participating in that program.
Yeah, and there's a permanent opt-out capability too.
Well, that's the other thing I was gonna ask is, in that same letter, and I don't know if it's on here, but to include the option to opt out if it's not included in this letter here.
It says, quote, consent can be removed at any time by sending an email, and then there's the link. It's the last thing in the letter.
That third paragraph of the letter.
And we set up a special email address for this information going back and forth so that the nurses wouldn't be overwhelmed and so that they could keep the day-to-day activities separate from the COVID. So the email address is jescovidinfo@johnsonschool.org. And if a parent has previously signed up, all they have to do is send a revision to that email, and we'll take care of it immediately. And Mr. Andrews will be putting this information in the newsletter too, and sending an email. Obviously, the letter will be sent by email also.
Thanks.
Thank you.
Yeah, I know way more about COVID-19 than I had ever anticipated knowing. I think we all do.
All right, if there's no other questions, we can move on. Is that all that you had for COVID-19?
Yeah. Again, all good for us. All good.
I have one other thing, just a thought in seeing things, for the notifications that go out to the school about there being a positive child, is it necessary to include the grade, given that we're such a small community? Is there any benefit to doing that we need to do that and to make it more
Anonymous.
private? Yeah,
In other words, don't put the grade.
correct.
I'm following the directive of the public health nurse. And we talk about it every week. And every week she says the same thing. If you're not going to put the grade, don't bother sending a letter.
Really?
When you think about it, parents want to know if it's my grade or not. I think I understand completely what you mean.
Yeah, I mean, I guess I mean, are there things that are gonna change because, you know, they don't know what the grade is? I mean,
Well,
think
let's say as an example, we sent a letter out a while ago about a preschool student. So if my kid's in the 6th grade, I went, whew. Or if my student's in the 6th grade and I have a preschool student, I went, So that's why we do it. So I'm not sure there's a right way, but I can ask again.
I mean, I see the point. You know, because the risk when following the measures that we have in place of, you know, transmission within the school is really low unless the student is identified as a close contact, in which case you'd be reaching out to that family separately to let them know that their student was a close contact, in which case that communication to that family is really important. Otherwise, I actually don't even know, do we need to send out an email saying that there's a COVID case in the school? Because I mean, the biggest risk of contact is outside of school. And honestly, that's within the, responsibility of the family, the child who has COVID to connect, because that wouldn't be the school's responsibility anyways.
I have been, as I said, every week we have this conversation. We go round and round.
Yeah.
What I have been told by the public health nurses, this is the best practice, and the chair is absolutely right. But if I'm that child of the 6th grade student and I have a 1st grade student who has a friend who's in preschool, I may want to know that. Even though you're absolutely right, the transmission's probably not going to be in school, but to keep, I guess I'm having a difficult time saying what I mean. Maybe to allow parents to know what out of school cohorts may have some transmission.
It seems like it must be the standard that's been communicated to schools across the state to send such letters. Is that correct, Tony? So I'm seeing that's kind of the common practice.
The common practice is actually to identify the homeroom.
Right. But
Yeah, which is basically what we're doing.
Right.
Yeah. I mean, it seems like it seems okay.
Yeah, I just, for our community being so small and there being only one class per grade, I think it's more identifying than it's intended to be.
Well, I think that's the point of the homeroom being identified in other schools, though.
Yeah.
They're bringing it down to that smaller level there too.
Yeah.
I think in this case, as superintendent, I would say more communication to establish information in the community is better than less communication because we're small. And even if we were in a huge school, if the principal identified the homeroom, the numbers wouldn't be very much different than our grade.
I think you're right. More information is generally better than less, especially in a high stress situation, which I think we're all in since this pandemic roars on. So it seems like it seems fine.
Yeah, pre-COVID, these communications would happen about strep and flu.
Yep.
But there
And foot and mouth.
factors in place.
Yeah, what I was thinking about is what would I do, and the reason I came to agree with Deb is what would I do as superintendent, or what would Kevin do if we had an unvaccinated student in grade X who developed one of the childhood viruses?
Yeah.
Well, we would sure as hell tell everybody in that grade.
Yep.
We would need to.
Yeah.
Because, we would be worried about in certain viruses, pregnant women, the elderly. And that's how I got to, let's keep doing it that way.
But
It was
sent to the grade, it wasn't sent to the whole school.
Yeah.
no, I disagree. If we had measles, I would call up Deb and say, how broad should the information be? And I think she would say, send a letter just like you have it with COVID. Say it's grade Bing, but if you think about it, that student has had special teachers, specialists. There are mixed cohorts at lunch and on the playground sometimes. I'm not saying I'm right. I'm just saying that's how I got there.
Yeah, and I hear what you're saying, you know, but also, you know, with those things, we don't have mitigation factors in place like we do now, you know, so I say that would be the only difference to me.
You're right. But I would say if it happened today, while we have the mitigation factors, I would still do it. Even though our students are masked, I would say that in case of measles or other diseases that we have vaccinations for, and we have students in school for a variety of reasons who are unvaccinated, I would say I would still do it. And I see a lot of nodding, so I think I may be on the right track.
I'll jump in on that one. I think, you know, what keeps coming up for me in these conversations is that the reality of science and information and the perception that's, you know, fear. And I think, you know, we're all parents, like normal, that something is going to happen to your child is those things are not always in concert. And so as you know, folks charged with supporting this process, you know, together, I think that more communication about this helps, you know, sort of cut perception gone wild off at the pass. You know, that, you know, I mean, I have had too many conversations with parents that are like, well, you know, Joe's cousin's mother's sister's someone got it at church. And even though Joe hasn't been with those people or that person at all, somehow it can get to him. And parents, you know, like, you know, who may not be as steeped in the education in the science aspect of it, you know, feel that, and it's real for them. The fear is real for them, you know. And to be honest, like, I mean, I try to, as frustrating as that is in some senses, and it feels like overkill, and like we're sort of feeding the beast sometimes in over communicating. I remember the first time my first child got a fever, you know, and I wanted to immediately, and the pediatrician was telling me, stay home. She's like 103, and the pediatrician, and she felt like she was like on death's door. And to me, as a first-time mom, and the pediatrician is like, it's nothing, stop calling me, you know. And I, you know, and I don't know, the panic humbles me. I'll never forget that panic, and it humbles me. And so I feel like there's the downside of non-communicating is far bigger than the downside of over communicating.
Yeah, I think as an administrator, it's easier for me to explain why I communicated than it is to explain why I didn't communicate. You know, health and safety, my caring nature about children, like all of us, you know, I mean, you know, because I wanted to keep staff and children and families safe. I mean, it's kind of an easy answer as compared to, well, I didn't do it because, and then whatever the reason is, it just doesn't sound as wholesome to me.
Yeah. My reason would just simply to protect the privacy of the person involved. That's all.
Yeah.
And that's also like caring, and we also need to carry that. It's a great point, Michelle. And my you know, my point wasn't coming against that. I just feel like these times, like, you're kind of damned if you do and damned if you don't. Direction, and we have to try to make the right direction and weigh all of this together.
Mm-hmm.
Welcome to our world. Madam Chair, I think it's time to move on to LED.
Sure.
Okay, so 4B is the LED project update. I am thrilled to tell you that 16 rooms have been converted to LED. We also have bathrooms being done today, and as soon as the electricians can put their hand on a lift, they will do the gymnasium. I sent you a little synopsis of phase 1, which I'd like to read to our community. The cost of the phase 1 of the LED conversion is $95,171. We got a national grid incentive of $23,936. The net cost is $71,235, all of which is being paid by the Nahant Green Communities Grant. So the actual cost is zero. We, in the past, have used about 32 kilowatts and 98 kilowatt hours. We will downsize the use to 10 kilowatts and 20 kilowatt hours. And here's the biggie. National Grid has told us that the phase one lighting that we're replacing in a year costs the taxpayer $17,888. And once we have a 12-month cycle, obviously the savings will start immediately, but the cost will be $3,636 per year. That would be obviously an enormous savings, percentage-wise, basically 3/4. If we were paying the $71,000, our rate of return would be 15% a year. But since we're not, the return is 100% a year. Interestingly, phase two, which I will summarize for you in writing down the road, it costs less, but the electric savings is greater because of the nature of the bulbs they're replacing. The return on investment of that one, and again, the cost is $45,201, the net cost, none of which we're paying for. The rate of return is 31% annually. So ultimately, we will take a $36,942 projected electric bill and pay $7,648 for the same amount of lighting once both phases are completed.
That's great.
I mean, it's just remarkable. And they're doing a great job. The electricians are neat. They haven't interfered with anybody. So it's a great project.
Great. That's some good news.
It is. And the solar project's still on hold. We're arguing with the National Grid.
Okay.
So, and the argument is a simple one. They want us to give them $10,000 to do a study, which may prove that they can't do it. That doesn't make any sense to me. If you want us to do a study, then give us a percentage. You know, it's 75% that we can, or it's 25%. They don't want to give us any information. So Tony Barletto and I are figuring out what to do next. We're looking for grant money. We're looking for help from our elected officials, et cetera, because we do want to do solar.
Mhm.
With the LED conversions and a solar array on our roof, we actually would save the town money. The school district would actually be producing more electricity than it's using. So in your packet, you have the second draft of the budget. The only change in this is that it is now in the format that the town accountant wants us to use. We converted it. It still shows a $106,148 increase because I have had no information that would lead me to believe the numbers are different. I will keep analyzing it. Madam Chair, moving forward with your permission to 4D, Johnson Elementary School facility use, it would seem that now would not be a prudent time to allow our building to be used by the community because of the lack of confidence in what's happening with the new variant. I don't know what else to say.
I'm mean, I imagine that was going to be the feedback from the administration. I guess my concern is, well, so there's two things. Other schools are open to people outside of this, students and staff. And so, which I think was something that I was just unaware of, or it just really never, dawned on me to even look into early on. So when they opened fully, without restrictions. And they're not closing down then to outside of students and staff, even with, cases on the rise in the new variant. So I know it seems like contradictory to the current numbers. I just can't see a strong reason not to allow, parents to come to the school, similar to when we have meetings for negotiations and meet in a room with the teachers of their students and the special education providers to discuss IEPs. And similarly, outside, like sports and things like that are being, accessed. Schools are being accessed to do things like sports in other schools. And with our, safety guidelines in place, it doesn't pose any additional risk to our students and staff the following day. So, although I understand the, reluctance to open things up further when numbers on the rise, I'm sort of in a situation where I don't know that there was a good reason that it was closed off in the first place. Other than when we reopened way before everybody else. And so we were super, super conservative.
I think that was the rationale. It was that at the time that we
course.
reopened, it was also
course.
before we knew as much as we do now.
Mhm.
So we opened with the most conservative guidance we could, prioritizing in-school learning. And I think, at this point, everything that you say resonates with me, Gina. I think it's important that we always make our decisions based upon what we know and not speculation. And so at this point, to me, the new variant worries me for lots of reasons. But at the same time, there's nothing to say that masking and hand hygiene aren't the primary modes of preventing spread and that they're not as effective. Everything says that they are as effective. So masking and hand hygiene seems like it's still the way to go. And so as long as that is the premise of any human being in close proximity to another human, outside of a household, as far as policy goes, it seems very reasonable to me. So I agree. I think that, policy wise, I think our policies should be in line with what we believe, what we know to be true. And then, as far as what we've said before, like other adults, other people going into the building would never be forced upon any classroom teacher. A classroom teacher invites, guests or parents into the classroom. That's the choice of the teacher. And I think if we're making policies for, what is allowed on a school committee level, we should make those based upon the most rational, most pragmatic approach we can. And everything that you just said, Gina, makes sense to me, including the use of the facility. I think when we made these decisions originally, it was that we didn't know how much contact, how much the virus could live on surfaces, and then therefore people coming in without being able to deep clean and sanitize a surface, was that safe for our students to be in that same room the next day? We didn't know. And so at this point, we do know. So it seems like as long as everyone who comes in and uses the facility, are told that masks are the rule here, and the next day when our students come in, they're all doing hand hygiene and masking with there right now. I don't see a reason why not either.
The only other thing I'll add is, the only situation I could see where a parent might want to access the school and meet with teachers, not necessarily, by invitation, would be for IEP meetings, which, part of our goal as the school committee would be, consistent access to all. And if it was a parent who has difficulty communicating over Zoom and is currently being forced to have an IEP meeting over video and not meet with their students, instructors, and special education providers in person, I think that's a disservice to that family. So having that option available, just as we meet, to, like today for the NTA negotiations, I think it would be appropriate, as long as they're following the guidelines, masked as it should be in the school, that they should be allowed to enter in the school for the meetings and such.
I'm in agreement as well. I just, it seems numbers are going to continue to fluctuate. There's going to be continued variances, and to Lauren's point, we know what we know now. And also with other recreational groups, the children are seeking that elsewhere, and I think it'd be beneficial to us to have community-based programs.
So just because I'm a newcomer, so I moved to Nahant during the pandemic, so I don't know what the heck happens at the school in a regular year. So do you mind just telling me what we're talking about exactly? Are there like a plethora of sports that are offered in the gym by family members during the winter?
There have been various activities offered in the past. So there is an intramural basketball league that's been run in the gym, multi-grade levels at once. There have been other parent, or community volunteers who have run other kind of small sport programs in the gymnasium as well over winter months. And then we've also in the past rented out the gym. Other groups, even from other neighboring towns, could apply to rent the space within our gymnasium.
Karate, there was karate before with TO programs, which everybody enjoyed.
There was other different things, even like things for adults that they could do in off hours.
And Tony, you were saying that you brought this to the administration and they didn't like the idea, any of these ideas, or I know the teacher piece, I remember that piece, but I wondered, like, how did they feel about outside groups coming in and using the gym or returning to some of the sports offerings that we had before? Were teachers and the nurses like concerned about that too?
Madam Chair, through you, the public health nurse and the school nurse are concerned. I did not run it by the staff. Clearly, I would have to. It may become a union issue. I don't know. It may become an issue of the staff feeling safe. I have
Which
no idea.
aspect, Mr. Parentaggi, which aspect are we talking about as far as the staff feeling safe or it being a union issue?
Well, as you were talking, I was making a list of, I'll try to say this as logically as I can. We're an educational institution. So if we're going to open up our school to individuals other than our staff and our students, then we should do it because of education and other reasons. So it would seem logical that if we were going to let our gym and other rooms be used, it would be allowed for the following reasons: for teacher training and professional development, for teachers to invite guests for educational purposes in their classrooms at their invitation. The PTO should be able to use the school. Facilities use should start again. Parents and guardians should be able to come into the school and visit their school with masks on. Obviously, special education parents would be encouraged to come in rather than do Zoom. And other professional activities which enhance the education of the students. It would seem to me that that list, although not in total inclusive, would be broad enough to allow the building to be open, but keep our focus on education, not on athletics or karate or, you know, it's because if we just let the building be used for those purposes, then I would have a hard time answering the why not question. You know, why not us? So I also made a list of what I know was in the gym or in the school before. We had the PTO offering programs of a variety of nature. We had a basketball leagues, both students and adults. We had hockey, floor hockey. We had a yoga group. We had a karate group. And I believe we had art classes. So one of the,
and Pilates at one point too.
what?
Just one more that's Pilates. One more thing too.
Pilates?
Yeah. There might be-
Pilates, Tony, don't forget Pilates. Don't mess with the karate people.
I would never mess with them, although I'd rather mess with them than the karate people.
Or the PTO, okay?
Yeah.
Don't mess with them.
Wouldn't team sports and physical fitness be health education?
Oh, boy.
Yeah, yes, there's no question. It's enhancing the physical fitness and the health of our students. But if we open it up and a men's group from Nahant wants to play basketball, I'm sure you don't want me to say no, and that's not enhancing the students at all. Nor is yoga class for residents.
But I don't understand why not. Like
Why not?
I don't. So why was it allowed before? Like, if it's not going to affect the students because it's on off hours, I don't understand why we couldn't still have community-based
Program.
opportunities for people to use the gym, even adults to get physical fitness and.
I'm not saying we shouldn't. I'm saying if we open it up to those groups, we have to open it up to the more direct groups that impact our students and the education. I'm not saying no. I'm saying yes to a broader group than just the people that use our facilities.
I guess the thing that's the sticking point for me that I'm having a hard time with, I don't care if it's basketball or biology. It's the fact that the school nurses, there's something about this that the school nurses, and maybe others are really against. And it feels weird as a school committee member to go against the school nurses. And I don't around this. It also feels a little weird that we have two really talented, nurses here that feel one way and two really talented nurses that work for the school that feel another way, and three healthcare folks, in this group. So here's an idea. And maybe this is terrible, but is there a world where there would be like a school meeting about this and the school staff could come and talk to parents and hear parents talk about this, and maybe the PTO could steward it? So parents talk, outside groups come, anybody who's really interested comes, adults all put it all out on the table. We listen, we listen, and then we bring it back here, right?
Isn't that kind of what these meetings are though? The community is supposed to be able to come and talk
What
here?
meetings? Our school committee meeting?
Yeah.
They're open
Okay.
to the community.
Then why don't, yes, but they're not, all those constituents aren't here. So maybe we need to, say, hey, next school committee meeting, we're going to be talking about this. Do y'all want to come and give comment on it? I don't know.
I felt like that's what was discussed at the last school committee meeting, and that we decided to table the item because Mr. Parentazzi was going to talk to the staff and come back with a list of, of opportunities when we would see a need to have access to the school and would come back. I guess what I want to know is, what are their specific concerns? Because if we look at the science, I don't see why not.
I agree. So I'm more than happy to hear what those concerns are. I just don't understand them at all right now. And
And they didn't come to that meeting, right? Like, I don't remember hearing, I remember one of us, and I can't remember who, I'm sorry, talking about an outside group that had approached them that really wanted to use the space. But I don't remember nurses coming and talking about this, and I don't remember parents weighing in on this particular item. And so that's why I'm saying, I remember we brought it up based on some folks that we had talked to out in the community, but I don't remember anybody weighing in on it, right? In which case, maybe we're making, like, we spent a lot of time going back and forth about this. And so I'm just like, is there a big constituents of like, if there's a huge amount of people that want to use the space, that matters. If there's a big feeling beyond the nurses, the nurses, and then beyond the nurses in the school, then that's significant, like, I just feel like I don't know what the level of concern is on these two areas.
My understanding, the concern is that, the way we've had things so far, our community has been safe, so we might as well stay it that way. And in my brain, I can sort of conceptually, compare that to, I've been at home, I don't have COVID, so I'm going to continue to be at home. Like, we know how to live with this, we know how to be safe. And we know, based on science, that with the protocols that we have in place, the protocols that we could have in place with other groups accessing the school, that our students and staff will continue to be safe.
And I think this is the third meeting that we've had that we've
Yes.
Yeah.
I think that's been plenty of opportunity for people to come and voice their concern one way or the other. And we haven't seen that. We did have, an ask from the PTO previously to use the space for education. So, I do think that, if the school was open and allowed before to rent for, education or physical activities, the things that Tony mentioned, I know what we know now, why wouldn't we allow that again? Tony, were there specific concerns from the nurses about it? Because
Yes, Madam Chair, through you, that's a good question. The specific concerns are that in other places that have had athletic close physical contact, supposedly with, quote, masks on, there have been outbreaks.
So have there been outbreaks within the people that are involved in that group? Or have there been outbreaks to the school community itself? Because those are two different things. And
Yeah, I would not have that. That's privileged information, so I don't know.
Yeah.
I mean, I think that, if there was and I have never heard of, anything like an outbreak in the school that didn't involve people that were physically there at that moment. And, these students that would theoretically participate. So what I'm saying is, an adult basketball team comes in, uses a school, they amongst themselves have a COVID outbreak because they're not following protocols, or maybe they are, or what have you. And then it actually affects the students and staff at the school.
No, I actually, Madam Chair, if I may differ with you, when the Pop Warner outbreak occurred in Swampscott, or when the soccer team outbreak happened, what happened is those students passed it around very quickly, and then it got brought home
Mhm.
to their siblings, their parents, and their relatives, and then it got brought into school.
So those
I mean, that-
sports and activities are happening. They're happening in Swampscott, they're happening in Salem, they're happening in Peabody. Our students who want to play sports are playing sports. And it's
Right.
actually beneficial for them to play sports if they want to play sports in Nahant, because our risk is lower and it's keeping it all together. So it's not a question of whether or not we let our students participate in extracurricular activities. The question is, could they do it at the Johnson School? And our mandate here, or the task to us is opening up the school to these activities posing a risk to our students and staff, and it's not.
Right, so I think as far as school committee
Yeah,
policy goes, this is where I get uncomfortable, like having a policy that doesn't seem to be in line with what some of us feel like is data-based feels wrong. What the school chooses to implement after that as an administration could be a little bit different. You know, there are two different things at play here, but a policy is what we're responsible for, and I feel like policies need to be based on fact and you know, pragmatic thinking. That I think that's where we're heading.
There have been functions at town hall. I mean, we just had the fair there. I didn't attend, so I couldn't say, but you know, there was the Christmas fair there, or holiday fair there, which is a community-based thing that people enjoy going to. And, you know, I mean, I just think that the data and the science is on our side to open. So do we have the policy of what was put into place before?
Yeah, I was actually looking at it when the school was reopened. It actually wasn't specifically, and I forwarded it on to all of you. It wasn't specifically outlined that the school is only open to students and staff, unless I missed that piece of the policy. I can say that we've consistently discussed it as a group at previous school committee meetings when we talk about facility use. And we've discussed, although not voted upon, not opening up the school to extracurricular activities. But it has, so
So we
I don't know that it technically needs to be voted upon, but it seems that it probably should be. I don't know logistically there. It's also not the school. I mean, I know that when the PTO came to the meeting to request the use of the facility, because it wasn't something that we were consistently doing, we did vote upon allowing the PTO science group to use the building, during inclement weather for the rest of the program. But, I don't want to run into a situation where we're voting on each,
Right.
facility request that comes in.
In the past, I think, Tony, I can't remember, Mr. Parentazzi, we did used to vote on allowing different groups to use our facility, though, didn't we?
Each time that they applied?
If they were outside groups, or was it just that we voted on the rates that we charged people? Was that what it was, Tony?
Yeah, Madam Chair, through you, yes, you approve the rates annually for a variety of things, and that's coming up soon. The only thing that I would suggest would be different about opening the school is you are suspending your 3-foot physical distance rule.
for athletics.
For anything.
Well, I think that as far as facility use, we keep the requirement for mask wearing because,
Right.
you can't. I mean, all of the requirements for youth sports have been removed. And that happened and then never came back. So all youth sports programs that, I've been a part of, some have masks, some don't. Nobody has a 3-foot rule.
Well, there's two issues. One is the intrinsic suspension of the 3-foot physical distance rule because of the activity that's being done. For example, you cannot play basketball and stay 3 feet away from anybody. The
Right.
second one is I'm not going to have any staff here to supervise this, so I'm going to be frank with you. I have absolutely no expectation that masks are going to be staying on these people. I don't know. Maybe it's going to be, maybe I'm completely wrong. Maybe it's going to be 100% mask wearing, or maybe it's going to be some place between 0 and 100. I don't know. But I know one thing, there's not going to be a staff member like Mr. Andrews or like a classroom teacher or anybody else in the building to supervise it.
So let's say that's true.
So there's two issues about the masking and 3-foot distance.
Okay, so let's say it's true. So are you talking about, you think that PTO isn't going to do it? You think that athletics isn't going to do it? Because it's outside of the school day, not involved with a school-based activity. It's still within the group. And if people don't want to follow the rules and they get caught, that they're going to lose their right to use a school. I mean, period. That's the only thing that we have control over there. If
Right.
staff is going to be available. And as a repercussion to the school, like we have just been talking about, is that COVID doesn't linger on surfaces. So at what risk would that be if that actually happened? And I'm not saying that I think that it's okay. I'm just saying I think that, just to talk about the fear about that happening.
Yeah, all I can say is that I don't have a specific group of people that I think will not follow the guideline, other than, just like earlier when we were talking about school bus mask wearing, human nature is going to be what it is. If there's not a classroom teacher or an administrator to say, I wish I had a dollar for every time in my 2 days a week when I'm in the Johnson Elementary School, I say, cover your nose, put your mask on. Mr. Andrews would be, I'm sure, much wealthier than I, and the classroom teachers even more so. But it's just human nature. And I think, it's certainly within the auspices of the school committee to recognize that and to say, it's time to open up anyway. And I will follow your directions. I don't know of any huge cry to use the building at this point. I think a couple of people have gone directly to you without stopping by my office, which is fine. I do know that the PTO asked for special consideration for their science program, and it was given. And but I also know that that was very professionally and very well supervised. And it was at a time when, frankly, I was here when it, not that I was in the class all the time, but I felt comfortable about dropping in. If somebody's here at 7 o'clock at night, the only person in the building is going to be the custodian, and the custodian is not going to check masks.
No,
I guess my question there is, let's just say that the worst case scenario plays out and a group is using the facility after hours and is not complying with the mask mandate, which I hope doesn't happen. Let's just say that it does. So what are we worried is the negative outcome to our school population that next day or in the ensuing days? What's the risk to our school population in general? I would think that, I don't want to think that this is going to happen because I worry about this, potential spread within whatever group is using the facility that evening. But if it's going to happen there, I suppose it would have happened wherever else they're currently renting to. And so I think that horse is already out of the barn. And I don't think we have any control over that. I mean, I think that what we can control is what happens during the school day when it comes to our school, right? So that's where we've had such amazing success, because we have such amazing leadership and amazing teachers and staff, and it's been great with parental, involvement too. It's been really wonderful, and we're so grateful. I'm not sure that what's happening after hours has any impact. I think that my personal concern back when we discussed this and decided that we didn't want to have groups using the facility was not knowing what happens to surfaces after exposure. And I don't have that fear anymore, because we've learned how this virus is spread. So that rationale that I personally used, to make a decision then is a moot point now. So I just don't know how I could explain it to someone if I'm defending our policy of not having the facility be used after hours, or having other, people into the building during the day either, as needed. I don't know what I should say.
So do we need a vote to?
Do we need to vote? But I think we should vote.
Okay, so if for the vote.
Maybe just before we vote, Michelle, I just want to, I've just asked a few questions. I understand what you're saying about science, and I agree with it. Basketball program sounds nice. Galileo would love to play basketball. As a mom, I feel that. I just don't know, again, can't get a sense of like how large the desire is or the detraction outside of this group. Feels very passionate in this group. So for me, it just doesn't feel like the battle to fight right now. I'm sure I'm being influenced by my own life outside of Nahant, but you fought the right battle to keep the schools open. It was the right battle, and we got that for everybody, and we've made it work collectively. And I don't know if there's big, if there's concern about it, the concern does not feel like, I don't know about like an outside men's basketball. It feels like just not the right time to even, regardless of science, it just doesn't feel like politically the right time to poke that bear. Kids sports after school, I mean, I get it, but I don't know. I don't know that that's the right battle. It feels like it might be a better battle for spring, but I do think we do need a clear rationale, whatever decision we make. And the rationale could be we're hearing that the school system is not comfortable yet. Whether they should be comfortable based on the science, like that's a different conversation, but that could be a rationale. But I do think that we need to, be able to say something for people that ask questions. I agree with that point that folks made. Anyway, I just wanted to put my voice out there before we vote.
Well, to your point from earlier, Beth, do you think it would be helpful to, have it explicitly listed on the agenda that this be something that we're going to, consider be voting on, and, reach out in particular to, invested parties, to invite them, and they don't have to come, but explicitly, invite our school nurse and public health nurse, because I would like to hear from them what those exact concerns are. It could be very helpful. And it could be helpful to have a dialogue in this kind of a forum.
Yes, yes, and yes. Like I emphatically think that this is the area where you over communicate, I'm obviously a fan of over communicating anyway. And I think that it would be super helpful for us to say, hey, we're going to do this. We're going to talk about it. We're going to hear. And then it also is like, if you don't come, and you don't send a representative, then you're not that invested, right? It's not do or die for you. And so that matters, right? Like there's that. And then the conversation matters. And then we still might end up here, but it would feel like at least we know like what's, where the passion is.
Yeah.
And what the rationale is.
Yeah.
The rationale is, it would be really great.
I think it would help make this job easier.
Yeah.
It's like if 100 Nahant parents show up And the most important thing, and it's some of it is me getting used to the town, you know, like everything here runs on Facebook. I didn't know that. I'm not on Facebook. I think it's an insidious company and I hate it. And I don't want to be a party to it. But guess what? I'm missing everything in Nahant because I'm not on Facebook. So I'm going to capitulate against my morals and get a goddamn Facebook. And so like I've learned that about Nahant. Maybe there's 100 parents where basketball is the most important thing, winter basketball, and 2 teachers show up. Important. Then maybe there's 100 parents and every teacher shows up and says, please don't do this. Super important.
I really hope even more than the number of people on either side, you know, why, like what exactly, you know,
Right.
what is it that,
Right.
even if it's one person, you know, what is it about it that
Right.
makes you uncomfortable would be really helpful.
Maybe everybody knows the science. Everybody's on that page. We don't even have to talk about that. And they do or don't want to have it, right? Maybe the science isn't an issue. Maybe a lot of people really don't know about the science. And then there's another, you know, like it feels like there's no downside to having kind of a big hoo-ha about it.
Mm-hmm. Makes sense.
Yeah.
And so what is that communication going to be then, if that's what we're going to do? So
Yeah, the agenda is available to everybody, but we can specifically ask the nurses if they want to come. Tony, if you want to invite them.
Yeah, Madam Chair, I respectfully suggest that we have a 4 groups of people right off the top of my head. Our public health nurse and school nurse, 1. The teachers and staff, 2. The contact people from the community who have utilized our facility in the past, 3. And the PTO.
Because they might want to use the facility. Is that why the PTO?
Yeah.
Okay.
Oh, I know they do.
That makes sense. And what I've done before when they're when I don't know, in the past, what some of us have done is, like you're saying, Beth, our town uses a lot of Facebook. If there's a topic people might have interest in, we've also sometimes, you know, school committee members have sometimes posted on there just to give a heads up to the community that this is going to be addressed. Because even when Mr. Andrews is really kind and like highlight something in a newsletter, some people get their news that way, some people get their news other ways. So we've kind of spread it multiple ways and seen if that increases participation. But
Yeah, at the very least, Madam Chair, if we went through this process, well, first of all, it's December 14th. I'm not worried about the next 2 weeks. Everybody's busy and they're doing other things. We have a school committee meeting.
January 11th. It's January 11th.
January 11th. That's about a week after we get back. And the bad weather, when everybody feels compressed. So that would be a good time if we're going to open it. It gives me an opportunity to invite these 4 groups of people and anybody else you can think of directly to that meeting. I would prefer and recommend that we do it at a regularly scheduled school committee meeting rather than having another night of meetings.
totally.
Because we're about to get into budget season with the FinCom. I will list the groups of people that I think should be on a level playing field. I mean, I did it very quickly off the top of my head. Guest teachers invite, professional development and training, could be done in person now, PTO. For example, we have on January 14th, we have a professional development day. And a lot of those activities would be remote, and maybe they don't have to be. So I'll make that list. I'll send it to you. Please feel free to add to it so that when we meet on January 14th, I have a concrete group of activities, and certain people, because of their interest in this, have been invited. And it'll be the lead item under new business. And Madam Chair, you can move it up to the beginning if you want. How's that for a plan?
Sure. Do you want to move on to the preschool program?
Pardon me?
Do you want to move on to the preschool program?
Oh, yeah. I'll tell you what I heard. Do you want to put that on Facebook? And my answer was going to be no. So I will send a message to the school committee members on Thursday, and I will outline those two things. Who I'm going to invite, and the groups that I think should be, if we open up, who should be, who we're opening it up to, and for what are we opening up? And then we can move forward. Preschool program is very quick. I had one thing I submitted on the wrong form, and today I submitted it on the right form. Our social worker has the process. I asked the state the process by which parents signed up for the voucher, so we have it. And we should be very soon, after the first of the year, be inviting parents and guardians who are in a low socioeconomic group to apply for state vouchers for our preschool program. And I think it's a tremendous benefit to the school district and the community.
Great. So we can move on to public comment, community correspondence. So if anybody on the call wanted to make any comments, or if any school committee members has had any correspondence with members of the community, that they could share it at this time. All right, seeing no comments, Mr. Parentazzi, could you give the facility update with your weatherization?
Certainly. In the first of all, the weatherization, it's completed. The weatherization project has been inspected by National Grid, and they inspected because the funding, if you noted when I was explaining the process for the LED, National Grid provides some of the funding for the weatherization. If you've had your house done by Mass Save, that money comes from the electric bill. If you look at your electric bill at the very bottom, it talks about, I forget what the line exactly says, but it's about utilizing energy efficiently. And there's a very small charge on each of our bills every month. But if you multiply that by 12 and then by everybody who gets an electric bill, it's not a small amount of money. And then, of course, there's federal and state grants, which really make it a significant amount of money. So the weatherization is complete, and you can already feel the difference in the building when you when you are outside the building. If you look at the doors, you see the black weather stripping. They weather stripped the building from the outside in, which was an interesting way of doing it. And then there's an additional set of weather strippings on the inside around the doors. So the air infiltration is very, very much less than it used to be. The rooftop unit, in the bill roll, you had about $10,000 worth of Monty bills. We have replaced a whole bunch of things in the rooftop unit. We're trying to save it because a lot of the rooftop unit is usable. I mean, you know, there's a metal box, you know, so we get a new one, we got to throw away a perfectly good metal box, have a crane take it off, a crane put the new one on, and all that costs money. New seals on the roof around it. I mean, there's lots of expense that really don't have a lot to do with the direct use of the item. One thing we are looking into, because it was recommended by the inspection by Amonte's expert, is this Thursday, a fan company is sending a representative, and we're looking at big, giant industrial fans in the cafeteria, because the way it's built, without going into unnecessary details, heat rises. Unfortunately, the heat from the rooftop unit comes into the room at the top of the room. So the heat is layered. The, the coldest part of the room is where we all live. So we're going to be putting at least 2 very large industrial fans that will take the heat and blow it down to us. And that will be cost effective, and it will also save the unit, hopefully. And I'll bring that cost to you down the road. And that's about it. Other than the principal has some exciting news about a pathway that we're going to have to keep our students off of Flash and Castle Road.
Before we move on to the principal's report, Mr. Parentazzi, did you want to address, I had approached Mr. Parentazzi because I don't know if anybody else saw this on the news. There was a story about the hand sanitizer that was sold to some schools, and we were amongst the schools listed that had purchased the hand sanitizer that was, I don't know, faulty or dangerous. And it was actually, I mean, I guess maybe this would be included in community correspondence, although it wasn't directed towards the school committee, but it was actually on the Nahant resident Facebook page. I had seen it on the news, and then I had seen somebody comment upon it. So I don't know if, obviously it's not a huge area of community interest, but you know, the Johnson school, Nahant schools were amongst the schools listed. So it might be worthwhile just addressing that.
Thank you very much.
Sanitizer that was used in the school.
Yeah, thank you very much, Madam Chair. I'd like to address it. I saw it on the news too, immediately came in, did an investigation of our paperwork, talked to Cheryl, found out that we had purchased about $175 worth of the Target hand sanitizer. The problem with the hand sanitizer was not the hand sanitizer itself. It was the advertisements and the conversations that were had with the purchasers like me and like the nurse by the salespeople in the company when it was claimed that it was 99.9% effective against the COVID-19 virus. And it did not have the amount of alcohol in it that was required to be that effective. So we found that out very quickly because it came in, we looked at the bottles and said, this doesn't have any of the stuff it's supposed to have. So we have $179 worth of hand sanitizer sitting in a closet. It was never used. No one was ever in danger of thinking they were sanitizing and not sanitizing. We are asking for help from the state to what to do next. And the reason is we didn't even spend any of our local money on it. We used grant money to purchase it. So now we have the AG saying it's no good and this company has to make things right again. And I believe the fine was $550,000. And then B, we have the grant funds that paid for it. So we have to like get those two entities talking to each other. The good news is the sanitizer was never used. We didn't buy a lot of it and we still have it all so we can return it.
Great. Thank you.
You're welcome.
Mr. Andrews, do you want to give the principal's report, please?
You're on mute.
Thank you. I've been on mute for so long, I forgot. So I'd like to start off with informing you about a public library collaboration that's underway. I've been meeting with Sharon Hawks, the director, and she's planning a series of visits to the school in the second half of the school year, starting January 18th, working in collaboration with the teachers to teach about at different grade levels, the parts of a book, how to make a book, and also how to conduct research safely online, and how to cite your sources. We're especially focusing on working with 5th and 6th graders to prepare them for middle school research assignments. And I'm looking forward to having this. She'll be doing one class. She'll be coming according to the regular library schedule, roughly, and each class will see her every other week. So in 1 week, Ms. Hawks will do a lesson, and then they'll do their regular library time where they would search for a book and check it out. And then the following week, they would have their typical library class with Ms. Fiore, where they have a read aloud, and then they search for a book. So they'll still have library each week. It'll be a bit longer when Ms. Hawks visits so that they can have their class and activity around the content. I also would like to let you know that we have a free 120-day trial of IXL in ELA. So students are spelling, learning grammar, learning reading comprehension using IXL. You're probably familiar with the math program that we use from them, which is really effective. And they offered us this free trial. And so we're trying it out and seeing if we can accelerate some learning in that area. It's also a great tool for when students aren't meeting with their book group for guided reading. They can independently go through an IXL lesson, and it supplements our reading program nicely because it offers spelling and letter ID, which we don't have a separate program for in some aspects.
Mr. Andrews, so when
Yes.
students access IXL at home through their Johnson School ID, will they be able to use some of the ELA programs? Or is it just like specific to each teacher has one log on for the ELA?
No, all of our students, have ELA activated right
Great.
now. Yeah. I encourage any student that is working on, especially the introductory reading, I think would be especially helpful. I haven't looked at the comprehension, although that's probably good as well. But a good book is great for reading comprehension too. So this is great for those drills that you want to really practice when you're really starting out in reading. On December 3rd, I was able to meet with the school council, minus Ms. Kobus. She was absent that day, or not available that day. But I met with Nancy Antrim and Kate Smethurst, who are also members of the school council, and we reviewed our school improvement plan. It's great to do this periodically so that we can remember what we were looking to accomplish in the school year. One area is a welcoming initiative, thinking about equity in the school and inclusion. One area that we noticed for inclusion that is important in our school is students who are new to the school should be welcomed and included, especially because so many of the students at the school have been together as one class for several years, and families have been in the town for several years. It's important that we think about what we need to do to make new families feel welcome. So Ms. Smethurst is coordinating a welcoming family initiative where when we get a new student, she'll reach out to the class, or she herself will reach out to the parent with, of course, the family's consent, to welcome them and to pair them up with a buddy who can answer questions about traditions that we have at the school, what's coming up, what to expect, and just be a resource for that new parent who might not know other parents in town. In a similar line, we've added an extracurricular page to our website. This lists all of the sports, how to sign up for lacrosse, how to sign up for basketball, how to join the Boy Scouts or Girl Scouts. And so there's a one-page place for all those recreation activities that new families would want to learn about. And so we have that on our webpage under parents. Next, I'd like to talk to you about what Mr. Parentozzi was referring to, the Community Preservation Act. I'm applying for CPA funding. I was able to attend a CPC meeting last month where they were talking about how to apply for the CPA funding. And my proposal will be to pick up the Heritage Trail from Flash Road. It starts in Lowlands parking lot. It goes through the woods, and then it crosses Flash Road and goes to the Flash Road playground, where it's a bit difficult to follow it. It actually goes all the way over to Bailey's Hill from there. But over the years, the signs that they had put up when it was originally installed have come off the trees, or the trees have come down, and the path itself isn't very clear. And so the concept is to put a stone dust pathway from the Flash Road playground, have it run behind the fire station and behind the DPW yard, and then connect to the access road behind the school. That's where the current Heritage Trail actually runs, although, like I said, you would really have a hard time finding it if you didn't know it was there. So I think the stone dust path will encourage students to walk and ride, and adults, off of the sidewalk and get out of the parking lots that are over there, and also just encourage another form of recreation. It seems that a lot of towns are having these rail trails, and they just kind of encourage people to get out and move. And it's a great activity during COVID-19 especially. The path actually goes by the community garden and goes through the woods and then up behind into the Coast Guard housing area. Very few people are aware of that. And so phase 2 would be to connect to that area. I was able to talk to Selectman Antrim, and he's in favor of the project. He is frequently outside in that area, and he told me that there will be still a space for the Heritage Trail when the Coast Guard housing is sold. So when that area is developed, as was voted on by town meeting, there still will be the Heritage Trail going through a couple of the yards in the Coast Guard housing area. The project will include signage of the plants and the habitats that you can find. I'm hoping we can add a meadow space to the Flash Road playground area, and also just identify some of the plants that you'll see there, so that folks really can connect with the wild native plants that are there, and also that are in the forest playground. So we'll have signage in the forest playground so folks can learn about what we have in that area. Under events, I have a couple things to announce. As Superintendent mentioned, there's a vaccine clinic. I have those 2 mentioned here. Those will be in the newsletter as well. One for staff and residents of Nahant, and one for children on December 21st from 3 to 8 p.m. I have to say, students are really excited to announce when they've had their second vaccine and let me know about it. And then they tell me, but I'm still gonna wear my mask. And it's nice to hear that they really have a concept of how this strange virus is working. I'd like to thank the students from Swampscott High School that graduated from the Johnson School, who came back for the Nahant Big Blue Parade. It was a great success, especially thanks to Ms. Shenna and the other parents that helped coordinate the event. Ms. Bascon is who I was thinking of. It was wonderful to see them and have something to celebrate. I think at this time of year, we're really looking forward to celebrations, and it's hard not being able to have those types of things. So having something outside, getting the students excited, building anticipation for it, and then seeing these fine young men who came and shared their victory. And then they also had a great little recess time with students out in the field. So that was really nicely done. And thanks also to NPD, Nahant Police Department, and Fire. We had a student council food drive, 1,600 items donated to the pantry. And the last item I wanted to let you know about was a program that we have about bullying coming up. This will be an online program, 2 sessions live, put on by the Middlesex Partnerships for Youth on January 18th. We'll have an assembly for grades 3 to 6 from 11 to 12, and also one for grades K to 2 from 1 to 2 p.m. And we're not seeing any recent activity in bullying behavior, although it's something that we always want to remind students about, how to treat each other with respect, and how to make sure that we are creating a safe and comfortable learning environment. So looking forward to that program from MPY in January. And that would conclude my report.
And then I also see that you included the agenda for the Professional Development Day in
I did.
January. Yeah, thank you.
I'd like to review that if I could.
Oh, sure.
Great, thanks. We're going to be blending some teacher-guided activity with some programming. We'll be reviewing our shelter-in-place and lockdown drills and how they operate. We do not have a plan for having students involved in a practice lockdown drill this year. Again, due to COVID. Typically in a lockdown, students get close together and are sitting silently for around 4 to 5 minutes. We decided that wouldn't be in anyone's best interest at this time, but we want to make sure the staff are aware of the procedures for lockdown and shelter in place. We'll also be planning the collaborative library project with Sharon Hawks. That's on January 14th as well on the Professional Development Day, and it'll be kicking off the following week. I'm most excited about our keynote activity on this day, which is mindfulness and media for faculty and staff. And this is about how to help students think about their thinking and really focus on the lesson that's being provided, helping students extend the amount of time they can attend to a lesson, and then also just being aware of how screen time can impact attention. So my main hope for it is to have students learn about how they can attend to a lesson and not be distracted by themselves or by their own thoughts. And then we'll also be working on how to collect evidence, which is part of the teacher evaluation tool. And finally, we'll have a demonstration by our contractor for our network, which is Integrity. They have a new tool where we could put all of the different student data that we get into one place. Currently, we use Google Sheets for this. So we'll put reading scores, MCAS scores, iReady onto the sheet. It's a manual process, and it doesn't have graphs associated with it. It's a simple spreadsheet. And so this is a tool that they're going to demonstrate to us to hopefully help us really take different pieces of data that we get and make a story out of them and understand how they can help student learning. And if we like the tool, then we can come before you and request that it be funded. And that's our PD day on January 14th. It's a full day. It's the Friday before Martin Luther King Day.
And also it's my birthday, which is the most important. No, I'm just kidding.
Fantastic. We'll be celebrating.
All right, thank you, Mr. Andrews, for that.
My pleasure.
So in new business, because we already talked about the COVID safety checks, I think we just have Island Routes personnel change on the agenda.
Yeah, thank you, Madam Chair. I actually had hand sanitizer down there, which we've already covered. The first thing I want to do is thank the PTO for their generosity of their holiday luncheon today for the staff. It was phenomenal, extraordinarily delicious food, and very, very generous by the PTO. And I'm sure Mr. Andrews will be passing along our appreciation in a more formal way.
Certainly.
And then as you remember, Island Roots, our lead staff member here at the school, resigned right before Thanksgiving. We have a new person, Mrs. B, a staff member who is known to us, is running the program, and it has continued without a hiccup, which is great.
Do you have any personnel matters? Oh, OT.
Madam Chair, yes, I'd like to note to you that we're in the process of a two-stage interview process for an occupational therapist and a team chair. Our director of special education and our principal interviewed people today, and they will be making a recommendation to me for a second interview, and hopefully we'll have these people in place. We need an occupational therapist because our occupational therapy specialist is not going to be able to continue. She's going to finish a couple of projects she's on, and that's going to be it. Our team chair has graciously agreed to stay on until we have a replacement. Once again, both of those individuals have communicated their intention of leaving at the first of the year. But we will continue. The good news is we have 3 applicants, and we have people. Actually, we already interviewed one. We have 4 applicants. So we'll be able to find someone. And that's it. Everything else in personnel is status quo.
So it sounds like we don't anticipate that there will be a lapse in services because we already have interested applicants.
Madam Chair, it is impossible for us to lapse services. That would be against both state and federal regulations. If we need to, we will hire a service to provide the team chair and the occupational therapy.
Okay.
Matter of fact, I talked to the Mary today about that. It's extraordinarily expensive. I can tell you it's $175 an hour.
Oh, wow.
That would not be our choice, but you have to provide the service, and we will.
And if I could just put a point of clarification, Chiedu Onoche is not leaving. She's our CODA. She provides the services.
Oh,
And the person who is leaving,
Her
Molly
supervisor.
Bergman, does the assessments and attends the meetings.
gotcha.
And supervises the CODA,
Correct.
who will hopefully have her degree by the end of the year, right?
Yep.
Yeah.
I don't have any business from the committee. I don't know if any other committee members have any business that they want to discuss. Yeah, Ms. Anderson.
I did, but noting that I was about 12 minutes late signing into the meeting, you may have already discussed this, but I was wondering, Mr. Andrews and Mr. Pierantozzi, whether teachers or others had brought up any concerns, concerns is too strong, any questions or feelings of anxiety based on the tragic incident in Michigan, the school shooting in Michigan, and whether there had been any questions about that. I certainly understand where there are very obvious differences between that situation and our school system. So I'm not intending any comparison that way, but I do think that in public education, when something happens, it definitely tends to give pause. So I just, and it's not a bad thing for us to pause and just sort of, check in on that. And I also noted that you were doing a training during the January 14th, that lockdown drill and other things with the teachers. So anyway, just thought I'd lift that unless it's already been lifted.
Yeah, thank you, Madam Chair, through you. Yeah, we do our trainings on an annual and regular basis. So the training was scheduled after the district crisis team met about a month ago, which I now find myself chairing. I personally have not had any direct contact with a staff member who expressed any elevated level of concern. However, one of the things I've noticed in the last couple of weeks is maybe a little bit of laxness about locking our doors on a regular basis. So for a good example is at the end of the school day, we prop the door open electronically, door 12, where the primary students leave. And then historically, on an irregular basis, we would all walk away and leave the door open. So today I personally had lamination of duty. We made signs that say, make sure this door is closed at all times. And we put them on the inside of all the doors to remind everybody that when you open the door, you have to close it. And that's been about it for us, for me. Mr. Andrews will obviously speak for himself.
Certainly, it hasn't come up at school. I would note that I'm just looking here, since August 1st, there's been 23 school shootings in the country. And so it's very, very unfortunate that this type of behavior has been continuing. And hopefully, students can, if it comes up at home, my recommendation for elementary students is to, speak to their parents about it. Older students can talk about it as a class, I think, but it is a sensitive topic, and also one that is far too common in the country.
I appreciate that. I also appreciate the story. I did the same thing, Tony. There's a door that's always opened at the Chelsea School, and I used the opportunity to read the Riot Act about that. But I do think that it raises anxiety. The number of, school-based shootings is higher than I think we've ever seen in our lifetime. And also, there are so many incidents where there are signs, right? And these are we can prevent these from happening. Not unilaterally, not everyone, but more than I think we have as a country. And I think that Michigan, for me as a school administrator, was a glaring example of, I don't even know what, but so many points along the way, as you all probably know, where if somebody had done something, we may not have had that incident, And so I just, it bears thinking about, in terms of like staff knowing the idea of like, if you see it, no matter what it is, say it, and so I just, that's what I've been emphasizing. And so, and I see a lot of safety, protocols I recognize them. It is hard to get into the Johnson School. I didn't even know about that door 12. At the end of the day, you cannot get into the school in the morning, from what I can see. And, it still is important to talk about. So I just wanted to raise it.
I think I will say that I know personally, when I see a student that looks unhappy, I think no one at the school really hesitates to ask somebody how they're doing and is ready to listen. And I think that's a key first step.
Yeah.
Thank you so much.
Gina, the only thing that I had was, because I need to take it, the chart in the course, there's one on February 5th at 8:15 in Everett, if anybody else needs to go. And then there's an online program in March.
I need to go, so I'll be there.
Thank you, Michelle, for that. Everett's way closer than most of them, so that's good.
Yeah, I was happy about that.
And Madam Chair, if I may, since the topic came up, any school committee member who takes one of the required courses, it has to be reported to the town clerk.
Okay, thank you.
They'll remind you at the end of the course too, which is great to bring that in.
If there's no other business from the committee, would somebody like to make a motion to adjourn to executive session?
I'll make a motion to adjourn the meeting of December 14th, 2021 at 9:18 p.m. to adjourn into executive session, not to reconvene an open session, for approval of executive session minutes from November 16th, 2021, and to conduct a strategy session in preparation for negotiations with union personnel.
I second the motion made by Ms. Sherlock.
All in favor, adjourning the meeting? Ms. Karas, Ms. Sherlock, Ms. Anderson, Ms. Sam, and myself. All right, have a good night. Ms. Reeves, Camilla.
Thank you.
Night.